pandemic. My name is Andy Thomas. I'm Chief Clinical Officer here at the State Wexner Medical Center, and I'm joined by three of my respected colleagues today. Dr. Ian Gonsenhauser is our Chief Quality and Patient Safety Officer for the Wexner Medical Center and has been a critical part of our COVID Command Center response. Dr. Susan Kolatar, Division Director of Infectious Diseases and a nationally recognized expert both on viral diseases and vaccine research. And Dr. Peter Moeller, Chief Scientific Officer for the Wexner Medical Center and Interim Vice President for Research for the Ohio State University. Our goal this morning is to cover updates related to the COVID pandemic. Dr. Kolatar will be covering some items around the mRNA vaccines, third doses, and doses for immunocompromised patients. And Dr. Moeller will be providing some updates on vaccine virus variants, including the Delta variant. And Dr. Gonsenhauser will have some remarks about the importance of both vaccination and the use of face masks in areas of high virus transmission with a specific focus around K through 12 schools. Then we'll be very happy to open things up for questions from the media, and we'll move forward from there. First, before we dive into those topics, I wanted to provide some information on the current level of cases and hospitalizations across our region. I'll share my screen here just to remind those in the media about when we talk about Zone 2 or Region 4, what we're talking about in the state of Ohio. These are the emergency management regions for the state. Zone 2, which is the zone with Central Ohio included, is Region 4, Region 7, and Region 8. Essentially all of the Central Ohio counties extending up northwest towards Bell Fountain. And then everything south on 23, south on 33, and east on 70. That southeastern quadrant of the state is what we talk about when we discuss Zone 2. These are the numbers, and we've shown these graphs in the past when we've had these events. The blue line is the total census of active COVID patients in the hospital on any given day. The red line are the total number of patients in the ICU with COVID on any given day. And the green line are patients on the ventilator with COVID on any given day. So this is the data for Zone 2, those three regions that I discussed. As you can see, starting back in late July, we've seen quite rapid rise in total COVID cases across Zone 2. That same pattern is in Region 4, the Central Ohio region, where we just are approaching 300 cases in the hospital in Region 4 hospitals. And here in Franklin County, if you look at the adult hospitals in the county and the average daily census, or the total census of COVID patients, we've just crossed 200 patients in the hospital. These quick rises over the last 4 weeks have many of us concerned about the ability of the healthcare systems across the state of Ohio to weather another large COVID patient surge. The elasticity or the resilience of those hospitals to expand beds, expand the ability to care for non-COVID patients is certainly in question moving forward. We're seeing in other states, Alabama, Texas, Florida come to mind, hospitals being overwhelmed by COVID patients to the point where those who don't have COVID are now seeing significant impacts to their care. We're seeing hospitals in Ohio being contacted by hospitals and emergency management regions all across the South asking for their patients to be transferred to Ohio. This is a difficult scenario, and we want to try and avoid that here in our state. We are not there now, but if the numbers keep rising over the next 4 to 6 weeks as they have been, we're in a significant concern that there will be problems with care here in the state. Right now in Ohio, 1 out of every 7 patients in the ICU for any reason is there because they have COVID. A month ago, that wasn't 1 in 7, it was 1 in 37. For patients on the ventilator, 1 out of every 5 patients on the ventilator for any reason in the state of Ohio is there because they have COVID. A month ago, that was 1 in 20. If those, the proportion of patients that have COVID in our ICUs and on our ventilators continues to increase at this rate, it's going to be continually difficult to provide the type of care that we'd like to provide in this state. All this is the backdrop of 50% of our population being vaccinated and over 80% of those over age 65 being vaccinated. With the impact of K through 12 schools starting, the cooling months of fall and winter, we think that there'll be a number of challenges over the next few months if these trends don't change. One last item to note, since April 1st of this year, the Wexner Medical Center has had 495 unique patients that have been admitted with COVID to our facility. We chose April 1st as the date since that's a date after which many of those at risk in our communities had the opportunity to be fully vaccinated. Out of those 495 unique patients, only 7 or 1.4% of those COVID admissions were fully vaccinated without another comorbidity, another illness diagnosis or reason for them to be in the hospital. With that, I'd like Sue, if you could cover a little bit about what we know about the effectiveness of the vaccines, both in preventing illness, but preventing serious illness, and maybe talk a little bit about the work we're doing with immune-compromised patients and getting third doses.
Sure. Thanks, Andy. Let me start by saying something that I've been saying for the last 2 years or however long this pandemic's been going, is that we continue to learn things every single day. And we try to take that knowledge and incorporate it into how we deliver care. And I think that's an important point to make. Your statistics about the hospitalizations and the vaccination rates among those, I think, is the most compelling reason to underscore the utility of the vaccines. We know that they work. The vaccines were designed to really minimize severity of disease, hospitalizations, and death. And we know that that's happening. But like any other viral infections, it's not uncommon and actually not unexpected that mutations will occur, variants will occur, and disease will continue unabated unless we can control population level exposure and vaccination. So the vaccines work. We know that. Vaccine effectiveness may wane over time. Again, not an unexpected thing in the world of virology and immunology. We have lots of experience with vaccines where additional doses are required, either as a primary series or as booster. Hepatitis B, the shingles vaccine, pretty much pick any vaccine. So I think the points I'd like to make is that one, vaccination clearly is important and makes a difference. And you've already made that in a more compelling way than I ever could. Number two, as immunity wanes over time, there's opportunities to boost or augment those responses with additional doses. And last week, the CDC, the FDA and the CDC reviewed all the data that looked at that, and particularly in some populations, notably those who are immunocompromised, either because they've had an organ transplant or undergoing chemotherapy or receiving agents for other conditions, those people will benefit from an additional dose. I think that's an important point to make. And then the final thing I'll say, because I don't want to take up too much time, is the idea of additional doses in people who have already been fully immunized is something that's on the table. I know there's been lots of press about that. Again, the FDA and the CDC will be reviewing that data. The preliminary reports look pretty good, that you get a significant increase in the immunologic response. And I think more to come on that. But certainly as a medical center, we are making plans to provide additional doses to those who are immunocompromised.
So Sue, just to make sure it's clear to differentiate, those that are immune compromised were what was formally announced last week by FDA and CDC. The state estimates that's 2 to 4% of all of those that have been vaccinated in the state up till now. We've started delivering those vaccines to those individuals on Tuesday of this week based on those new FDA and CDC guidelines. But the third dose for kind of everybody else, even though it has been announced that that's a goal, the FDA and CDC have not yet actually described or defined how that will work, when it should happen. And so that most likely is something that won't start until later in September or October, correct?
Right. Yeah, that's exactly right. There is a distinction between those people who fall into that immunocompromised group and those who have just received a vaccine series for other reasons. And so I want to say I'm optimistic, but I think we should take things in the order that we know they're being rolled out. And certainly our commitment to the immunocompromised population and additional doses is a primary focus, at least today.
Right. Thank you, Sue.
Yeah.
Dr. Moeller, can you talk to us a little bit about what we have learned about the Delta variant since we were all last together with the media and what we're seeing in terms of genomic sequencing?
Absolutely. So at the Wexner Medical Center, for really the last year and a half, we have been deeply engaged in the science of all things COVID-19, from testing to therapeutic development to a host of clinical trials, well over 100 different studies focusing. So we have the best data to provide results for the community. What we know, Andy, today about the Delta variant is that this is a variant strain of COVID-19 that has between 12 and 14 different mutations. And to put that in perspective, 12 to 14 out of almost a total of 1,300 residues or train cars that are in the spike protein of the virus. So it's a very small number. With that said, we have learned that this Delta variant is well over 2 times more infectious. So imagine having a fish hook. Imagine having then a fish hook that has 3 hooks on it. It's much more easy to bind to a cell surface of a lung. We also now know that this is not only more infectious, but it can cause much more severe disease, as you've mentioned before. With that said, when we designed the vaccine, we designed it in a way to target all 1,300 of those amino acids in the spike protein. And we're very pleased today to be able to tell you, and as Dr. Kolatar said, the vaccines that are currently being used in the market today are still incredibly effective against symptomatic disease. To put that in perspective, a year and a half ago, we were hoping that the vaccines would be 50% effective. They're nearly 90% effective, even against the Delta variant.
Can you talk about what we're seeing coming down the road with other variants? I know people talk about the Lambda variant and just kind of genetically where this virus is going.
Absolutely. So great question. And again, these are things that we're looking at every day here at the Wexner Medical Center and the Ohio State University. We have a sequencing lab that when we see a positive sample being detected in the community, we go through and look at every single base pair of that virus. And what we're seeing now, Andy, is about 100% of our cases now in the community are the Delta variant. We knew this was coming, and in fact, we're expecting that there's 24 letters in the Greek alphabet, that we're going to see a continuation of different variants that have different capabilities. Again, the other good news is science is out in front of this, and we're thinking about booster design similar to how the flu vaccine might change every year to be able to combat this. And so again, it's important that we continue to do research so we can stay well ahead of the game.
Great. Thank you, Peter. I will remind our folks with the media, if you have a question, please use the raise hand function in Zoom. And after Dr. Gonsenhauser's remarks, we'll turn to the media for Q&A. Ian, so, for a long time, we talked about folks that were vaccinated, didn't need to wear masks, and then nobody needed to wear masks. And now we've kind of moved back with some CDC and guidance probably 2 or 3 weeks ago. Here at the university, we're now back masked when in person in close proximity to others for both vaccinated and unvaccinated. Can you explain a little bit about why that is based on what we're seeing?
Yeah, absolutely. Thank you, Dr. Thomas. So obviously, we're seeing numbers increase across all of our communities as a result of the Delta variant. And as Dr. Thomas shared with you, we're starting to see peaks that are, while not approaching the largest peak that we've seen, starting to compete for the second largest peak that we've seen at this point. And with that increase in community prevalence, the risk to all of us increases and starts to increase substantially. One thing for everybody to recognize is that as community prevalence increases, our vaccine efficacy decreases. So if you're in an environment where there's a lot of COVID around you, you are more likely and at greater risk to potentially have a breakthrough infection or an infection if you have not been vaccinated. So with that, we return to the mechanisms and the precautions that we know are effective. And there is, while there's debate about masks, there is no debate about the efficacy of masks. These are proven interventions that we know reduce risk to some extent to the wearer and largely to the community at large, particularly by preventing those who are infected with COVID from spreading that in the community. What we have to account for is what is quickly becoming one of our higher risk cohorts across the nation, and that is our younger and unvaccinated children. Many people don't realize that right now, 1 in 5 COVID patients is a child, is one of our kids. And many of those kids are in that group that have not yet had a vaccine approved for their use. So particularly when we look at our school systems and the necessity to keep our school-age children safe, that really has led to what we've seen across the nation. 12 of the largest 20 school systems across the country are now requiring masks, and that is expressly to keep our children safe, to keep our educators safe, and to keep us safe at home when our kids return at the end of the day, potentially having been exposed to another kid with COVID. So, the return to those precautions that we know are successful, return to those interventions that we know can buy us some time between now and hopefully increasing that number of vaccinated individuals, as well as to better understanding how we can mitigate the risk that presents itself with new variants. Mask use is as important now as it has ever been, and really encourage everybody where there are options to opt to use a mask, and where there are requirements to fulfill the obligation to meet those requirements and reduce everybody's risk.
I think when thinking about the close proximity of kids in a classroom for an extended period of time, those that are unvaccinated, I think it's very, very clear case. But even those that are vaccinated, given the duration of exposure and the contagiousness, as Peter described with the Delta variant, I think it makes a lot of sense. I think what we're seeing in the South now of schools with hundreds, if not thousands of kids a week into class that are already quarantined or home with infections. I think for any school district that wants to have in-person classes and keep their sports programs, their extracurriculars, the debate team, whatever it is, if they aren't doing masks in addition to having as many people vaccinated as possible, I think it's going to be very difficult to complete a school year without significant numbers of quarantines.
Yeah, on that point, as you look at large school systems across the nation, this includes Texas and Florida and elsewhere, there are thousands of children currently on quarantine lists who are not able to attend school based on exposures. There are hundreds of children in these school systems that have been exposed and now are positive for COVID. So for parents out there who are concerned about the impact that masks may have on your child's education, keep in mind that if that mask is going to keep them in school rather than being quarantined for 2 weeks, potentially multiple times over the school year, that's a major benefit. There are also a number of studies that have come out recently that support that children's development is better preserved with opaque masks that you can't see through, than with either clear masks or plexiglass barriers. So we've got an overwhelming evidence that masks can actually improve education for your children by keeping them in school and by keeping them from needing to be exposed to other interventions that are less conducive to their educational needs.
Thank you, Ian. That's terrific comments. We'll open it up now to members of the media with questions. I believe our first question will come from Max Philby from the Dispatch. Good morning, Max.
Morning. Thanks for doing this. Two quick questions about boosters. One, would you advise or not advise that somebody who's maybe going to get their flu shot just get their COVID booster while they're at it, or could that make them feel kind of crummy like it did maybe after the second COVID shot? And then secondly, given that a lot of the general public, got their COVID shots in late March, early to mid-April, are you guys prepared for what could possibly be a holiday rush in November or December? And how do you handle something like that?
Yeah,
Thanks.
Sue, why don't you take the first question about the joint flu and COVID vaccination? I'll take the second one.
Sure. The current thinking is that you can get more than one vaccine at a time. So the early studies actually try to separate those. Then it gets down to a question of convenience and utility, I think, in terms of actually getting the vaccines. But can you do it? You can. I think it might make you feel crummy. And but it also will help us sort of facilitate vaccine delivery across the board. I will say in reference to Ian's points about masking, that also had a huge impact on influenza and other respiratory illnesses, and probably even including RSV, which is a respiratory illness in children, which is really starting to raise its head. So the short answer is yes, you can get them. How we roll that out, I'll toss that to Andy.
Yeah, Sue, and to your point about influenza, the last time I looked at the stats a few weeks ago, I think normally in Ohio we have 7,000, 8,000, 9,000 flu admissions per year. We were under 200 for last flu season based on use of masks. It's really amazing. And Max, in terms of your question, in terms of the timing, right now we have 4 sites open as in our primary care clinics and walk-in clinics for individuals to get the COVID vaccine. We actually have, I believe, 5 or 6 more that are in the midst of development over the next few weeks. that will be opening. We also have reopened currently our Ackerman Road site, mainly for immune compromised patients a few evenings per week. We are currently looking at our capacity and what we expect for demand for third doses, and we'll be working, as are the other health systems in the city, plus the Columbus Public Health Department and Franklin County Public Health are also planning some options for individuals for vaccination that you'll hear more about, I think, in the next few weeks. Plus, a main difference we have now compared to the first rollout of the vaccine is pretty much every local retail pharmacy has a vaccine as well. So we think there are going to be a lot more options than there were, say, in January or February of last year for the third dose vaccine. Next question, Gabriela Garcia.
Hi there. Thank you guys for doing this. I had two questions. The first, I know you guys shared a few numbers about numbers of hospitalizations and things like that. I was wondering if you guys could get a little deeper into that in your hospital specifically. How close are we to getting to the situation, in the South where they don't have any more ICU beds? Like, how close are we exactly? And then we've heard things from other doctors about people who are obese being more affected by COVID-19, and any advice for those folks, and if you can get deeper into that issue as well, I'd appreciate it.
Let's take the second question first. I don't know, Ian or Sue, if you want to cover the impact of obesity on patient outcomes.
Yeah, well, let me just say obesity has a negative impact on patient outcomes for all kinds of health conditions. So certainly in terms of what can that population do, one is to get a vaccine. That's the first thing. And then two, do other things that make sense that we know, wearing masks out in public and other things. And then three, really trying to address the underlying issue, which is not an easy thing to do. But I will forever stand behind the vaccines work in those populations as well.
Ian, do you want to add anything to that in terms of patient outcomes?
No, just, I agree entirely with Dr. Kolatar. There are many impacts and many comorbidities that are associated with obesity. In this case, a respiratory illness like this that can cause people to really have severe respiratory distress and respiratory failure. There are many components, many issues physically and anatomically with morbid obesity in particular that compromise the ability to easily ventilate and breathe effectively. And so if you are somebody who is impacted by COVID and has a significant illness and you are also obese, when you get to that potential for criticality in your infection and your needs to find breathing and breathing support, there are very, very significant issues that can be impacted. And we do have great difficulties in some of the rescue and resuscitation efforts for individuals who are morbidly obese in particular when it comes to COVID.
Yeah, just the practical aspects of delivering oxygen under pressure. I think especially with proning patients on their belly is a little more difficult with those patients.
That's exactly right.
Gabriela, per your other question, so I'm on calls multiple times per week with leaders from around the state, from around the zone, as well as here locally in Columbus. And I feel like I have a decent finger on the pulse of how people are feeling. From a stress level and the voices that I hear on these calls, it's significantly different than a month ago, even different than 2 weeks ago in terms of people looking forward. Just to give you a sense, if we're at over 400 patients in zone 2 today in the hospital with COVID, if you look back over the last week, we're at between 120 or 100 to 120 more patients than 7 days ago. So if you fast forward 4 weeks, we'll be doubling the number of COVID patients again to probably between 800 and 900 patients if this rate of increase continues, with 100 more patients per 7 days in the hospital. I think the feelings of my colleagues in leadership roles around the state are a couple. One is we're seeing significant numbers of non-COVID patients in the hospital, and we've been seeing that now for 2 to 3 months. Some of that is related to people that have delayed care during the bulk of the pandemic over the winter. Some of them are people who maybe haven't seen their doctor as much as they could have or should have. and just are presenting to hospitals with a more advanced illness maybe than we would have seen before. There's a statistic called the case mix index, which is a measure of acuity of patients, and it's significantly elevated at most hospitals around the state. So we're starting out from a baseline of being quite busy from a non-COVID perspective. If you ask the average emergency room doctor here in Columbus, our ERs are in many cases bursting at the seams already prior to the last 2 to 4 weeks of seeing now increased numbers of COVID patients. I think the other piece that's of concern is our staffing. People have been working pretty much nonstop for the last 18 months. It's been a busy time with a lot of doctors, nurses, respiratory therapists, patient care aides, working overtime, working extra shifts. And we kind of went through this back in the November, December, January timeframe before there was a vaccine. And I think much like the rest of society, people kind of breathed a little sigh of relief in the late spring and early summer as numbers were low, people were getting vaccinated, et cetera. So I think you add in the fatigue and then to be honest, some frustration of people not wanting to get vaccinated, people not wearing masks, and then ending up in our emergency room or on our inpatient units. You add all that together and it's a pretty demoralized group of people that we need to keep making sure that we're recognizing them, showing them concern, compassion, empathy, as they work to take care of those in our society that unfortunately are contracting this illness. And as I said, a lot of non-COVID patients at the same time. So when you look at where we sit in terms of the need for concern, I think over the next 2 to 4 weeks, you'll see a number of hospitals potentially making difficult decisions of limiting elective care, potentially closing some outpatient services in order to redistribute staff to cover additional patients in the hospital. I know of one hospital in the zone that has actually done some of that already this week. I know in talking to colleagues in Cleveland that have hospitals that they own down in the state of Florida, they've been doing that now for 2 to 3 weeks of actually of needing to cut back on elective services to redistribute staff and redistribute bed resources. So I don't think today we are at a breaking point, but if the trends continue unabated with increases in admissions to the hospital, I think 2 weeks, 4 weeks from now, that we may see some hospitals, and not just in Columbus, but across the region, needing to make difficult decisions about balancing types of patients that they care for. Next up, Jackie Orozco.
Can you guys hear me?
Yes, we can. Thank you.
Great. All right. Thank you for doing this. This is Jackie with ABC6. I just had a quick question. We've been talking about the boosters and the third vaccine in terms of folks that have received the Moderna and Pfizer. How about those who have received the Johnson & Johnson? And since it was only a one shot, do you also recommend them getting a booster coming this winter if they received it last year? What should they do?
Dr. Kolochar, that question has your name all over it.
I was sitting here wondering who was going to ask that question, actually, since we sort of talked around that. So you're correct. The recommendations are actually for the mRNA vaccines, and that's what the ACIP discussed last week. The J&J vaccine is probably a little, in terms of actual timing, is probably a month or so behind. So at the moment, there is no recommendation for that group of people, but I anticipate that will be coming soon because I know J&J are collecting the data regarding that. So maybe we'll do another media briefing and I'll actually have a real answer for that question. But currently the recommendations are for those people who got the mRNA vaccines. And I'll just add that the recommendation is also that you get the same vaccine if you can, but it's not critical. So I'll have a better answer maybe in a month.
Great. Thank you, Sue.
Yeah.
Max, did I see your hand up with an additional question?
It was answered. Thank you.
Terrific. Any other questions from the media today? I don't see any other hands raised. If you're just on with audio, if you just want to unmute and ask a question, that would be fine too. Terrific. We're not seeing any additional questions. We'll go ahead and call it a day for today. Once again, thanking our guests, Dr. Moeller, Dr. Gonsalves, Dr. Kolochar for being with us today. And thank all of you for all you're doing to make sure that we're getting good information out to those in our community. I think Columbus, the media here has done an outstanding job of sharing accurate and concise and actionable information for people, unlike some of what we see from other venues. So thank you all very, very much. And we will be doing these periodically moving forward, and we'll look forward to having you all join us again next time.
Andy, can I just finish
Sure.
by saying that what I said was true before. We continue to learn new things every day, and I think it's our commitment to the community and to you all to continue to share that information, because it really does change almost daily. So
Great.
my final word.
Terrific. Thanks, Sue. Thanks, everyone. We'll see you soon.